been committed to improving healthcare since I was 16 and had a bad experience with my grandmother, her heart attack, and an ICU, basically. And just didn't know anything about healthcare, of course, but felt, wow, this is strange and awful that people who were so anxious and upset going through healthcare experiences with their loved ones are not being treated with respect and compassion. So I didn't have the words for it, but later found an opportunity to enter into healthcare, and every time I see somebody's grandmother in a wheelchair, I'm raring to go again. So that image stays with me, and I think that that was really the birth of my passion for working on improving the humanism in the healthcare system. I worked for 20 years at the Albert Einstein Healthcare Network, which is a big system in Philadelphia, and during those 20 years, spent 7 years starting and running what was called the Einstein Consulting Group. In my early days at Einstein, the president said, "Hey, Wendy, can you fix the attitude around here?" And I said, "How many people have an attitude problem?" And he said, 3,000. And I said, "That's quite a powerful screening process you have to find 3,000 people with attitude problems." So what I realized pretty instantly is the power of culture to affect employee performance and morale, and developed a strategy called hospitality, hospital in caps, and managed that process at Einstein. We had some great results. It sort of kicked us into a business, as other hospitals said, "Can you help us do that here?" And that's when I formed the Einstein Consulting Group. For 7 years, we helped hospitals nationwide institute customized culture change strategies, or comprehensive service excellence strategies that were almost Studer-ish in terms of scope, you know, starting with leadership and behavior standards and management practices and frontline training. After 7 years, I left the consulting and became an inside change coach at Einstein. And I became a VP for human resources. During those years, I was responsible for nurse retention. I've always believed so strongly that retention is a matter of culture and job gratification. It's not a matter of pay rates. And I did a lot of work observing nurses, interviewing nurses, focus groups, shadowing, to understand what life was like during those lean times. And that's when it hit me that nurses were disaffected and patients were dissatisfied, from my perspective, because healthcare workers had become exclusively task-oriented, with the pressure increasing so severely in their work. You couldn't see the compassion. But I knew that people there were not 3,000 people with attitude problems. They were caring people who wanted to make an impact on other people's lives. So I became really interested in the quality of the interaction and started to narrow down to what has really become our niche, which is focusing on the role of communication and the quality of the conversations that go on day and night between caregivers, patients and families, coworker to coworker, physician to nurse. So I left Einstein on my 20th anniversary to get back to spending 100% of my energy for work on improving the patient and family experience. I wanted to focus my work on building and advancing what we now really see as a movement. So I left Einstein, provided consulting services on service excellence and patient experience, pretty quickly realized I really needed help, and both at Einstein, we had engaged Jill for some leadership work, and she was on her own consulting. So when I had the need for help, Jill was completely my right arm and started to work like crazy with healthcare clients and do really fabulous work, transforming work with our healthcare clients, and we did some projects together. You mind telling people a little bit about the WellSpan experience, because this is very pivotal around the development of the language of caring.
So we're at WellSpan, which is in York, Pennsylvania. Wendy and we're around the table with their senior leadership, as well as Jamie Markle, who's their director, at that time was their director of organization development. So we're talking about doing the language of caring there, and we're describing it as a 2-hour PowerPoint-based workshop, and we can take people through all these great skills. And this one leader in the room is like, that sounds great, but could you do it in 20-minute chunks? And so as a long-time organization development and leadership development consultant, honestly, my first reaction was, here's one more leader who says that this is really important, but wants you to do a day of training in an hour, kind of thing. So, but instead of pushing back, we started asking questions like, well, what would that look like? And what do you mean? And what value would that have? And then all the way home, we were like, and then we could do it in 20-minute chunks, 30-minute chunks maybe, and we could do one skill at a time, and oh my gosh, it could be video-based. And like, by the time we were home, the product was real, the program was really in its current form in our mind. WellSpan agreed to let us shoot it there. And so we shot the first set of videos, the language of caring with WellSpan.
They loved it. They instituted it organization-wide, and we launched it in the marketplace and have been selling that program and set of implementation support services ever since. So WellSpan, thank goodness for WellSpan, helped us really form the image of the language of caring in our minds. So we worked with the language of caring and also the program that some of you know called Great Every Time, narrowing down more and more into a communication niche. Jill was such a partner for me. So I approached Jill like, let's get in business together, which had to be hard for her because she had a lot of other clients like trucking companies and all this other crazy stuff. That's when we formed Leebov Golde and Associates. Together, we were much more powerful than either one of us separately. Meanwhile, the healthcare environment is changing. So suddenly you have HCAPs, and you have pay for performance, and you have all these forces aligning in the universe to focus healthcare executives and boards on patient experience scores. And we had a giant opportunity. So we talked and decided, let's find another partner and seize this opportunity to affect the patient experience through a larger team of wonderful people. And thankfully, Dorothy and Amy dropped in at the Leebov Golde and Associates exhibit at the Plane Tree Conference and sat themselves down, and I felt an immediate connection. Eventually, Dorothy and Amy became associates, and then we realized how fabulous it would be for Dorothy to become a partner. So the three of us are full equal partners in Leebov Golde Group, and that brings you up to date.